Can I start? Uh, Hello, everyone. Welcome to the relaunch of Planetary Health course, now recommended by the World Health Organization in a letter to universities and all education stakeholders. We have been living a huge ecological and health crisis around the world. The way that we human beings have dealt with the environment is a crucial issue and needs our full attention. For us from Telesaúde RS, it is a great pleasure and honor to host the Planetary Health course and our educational platform. This is an important answer to these challenges in our darkest hour. The initiative is led by Dr. Mayera Floss with intense collaboration from Planetary Health Alliance and WONCA. Today, represented here by Professor Carlos Guzman and Professor Ozen Gogdener, besides having the participation of colleagues from several countries. About TSS, we started our mission 70 years ago and developed the expertise to support primary care professionals in different areas. Now, I will present briefly some of our activities. Telesaúde RS is a telehealth service provided by the Medical School of the Federal University of Rio Grande do Sul. And our objectives are improve health professional skills, eliminate distance and decrease consultation waiting time, and improve people's health. Our actions are consulting, diagnosis, referral management, education, and technology development. We start in the past year, post-COVID-19 changes on legislation with monitoring and directly consult to patients. Resume, we believe in try to do large-scale services, ap, applicable innovation to SUS, our national health services, and high-quality research. Teleconsulting. We have a hotline available for all Brazil. We perform decision making for doctors, nurses, and dentistry, assisting in solving health problems and doubts in real time. This is our team with a lot of medical specialties, nurses, and dentistries. And some results, we performed more than 305,000 teleconsultations provided, referrals avoided in 75% of cases, and the net uh, no a net satisfaction score. Okay,
I think we are not seeing.
okay,
We are
these
seeing.
slides,
Yeah, we are seeing like just the initial
the
screen
initial. Okay,
at
I
the
I
PowerPoint.
try
Yeah.
to I try to do here. Uh-huh. Sub I ask now.
I don't think so, Marcel. I think
Okay,
you're sharing just your. We are seeing like the working.
okay,
I think like you can keep going, but then we keep seeing
okay.
your
Now
screen on
now you see
the
a new
working
slides
place.
working place.
Yeah,
Okay,
but yeah,
I
yeah.
I will I will present here the working place. This some photos and the telehealth. This is teleconsultations by telephone hotline. It's a sustainable increase in the years and the slight reduction in the last year, probably because the post-COVID pandemic. Another action is referral management. We try to decrease the wait and time for specialized consultations, avoid unnecessary patient displacement, and increase the resoluteness by primary care. Some specialties we performed a study in endocrinology, neurology, and rheumatology, and the resolutivity for these specialties, for every 3 patients discussed with us, 2 are resolved by teleconsulting. And this is important to uh, to do to say it's reduce the transportation by car, and in this reduce to the carbon dioxide emission. Some lists, waiting lists after the intervention by telehealth, and it's possible to see the important fall in this wait lines. Neurology and rheumatology too. Here, the key reduction in January of the 2016, the waiting time for an appointment in the adult neurology specialty was 645 days, and after the intervention, this time, so just to 42 days in September 2018. Telediagnosis, we have some objectives to increase the access to specialized exams, decrease patient travels, referrals to specialists, and decrease the waiting time for the exams. Some examples like RespirNet is a spirometry accessible to 100% of Rio Grande do Sul's population. The response time for the report is almost 15 days, and we performed over 37,000 exams until now. The teleophthalmo is telemedicine in the service of eye health, and we performed more than 42,000 exams. This is a telepresence consultation with our ophthalmologist. Um, we performed until now almost 120,000 uh, telediagnoses, included dermatology and the stomatology too. In the teleeducation, it's a focus of our course. We have more than 5 million views on YouTube, and over 83,000 certified health professionals. And this are some course in our platform, like Venus Animals, Health Information System, Menopause, and uh, mainly Health Planetary. This is our website and our supporters, like the Minister of Health, Secretary of State of Health, and the other supports like FAURGS, our Foundation of University Federal. I think is this my presentation, and now I continue the event. I'd like to call Professor Carlos Guzman. He is a physician and associate director of Planetary Health Alliance and co-founder and the current director of the Inter-American Center for Global Health. It's the first global health center in Central America and seeks to redefine the meaning of leadership in global health through innovative educational approaches. He's also assistant professor and director of global health programs at the University of Maryland, Baltimore Graduate School. He obtained his medical degree from the University of Costa Rica and his master's degree at international health at Queen Mary University in Edinburgh and Virgin University in Amsterdam. Dr. Farron is a member of the Central American Healthcare Initiative and an adjunct professor in the Department of Oral Health Policy and Epidemiology at Harvard University and the Graduate School of the University of Maryland. Carlos, with you now.
Thank you, Marcelo, for that introduction. And thank you again for inviting me to this exciting launch of the course. It is very exciting. I see Mayara, very, very exciting. It's a very, very international and huge effort that we've been embedded in. And I'm really happy to see, well, Mayara will share with us later all the data from the first cohort. So what I'll do is I'm set here to talk to you about why we must think of planetary health education as a priority. So I'd like to share some images with you and run you through why it is now a good moment to undergo a planetary health education. So this is the usual starting point, and if you take the course, you'll usually see images like this, in which I won't spend too much time explaining it, but what you do have to know is that we have ongoing, and this here, ongoing simultaneous intertwined environmental crises going on, and that those are impacting the health of the populations all over the world, especially the populations that are more at risk, more marginalized, and that are more vulnerable. And to note here is that today we are starting to understand better and better how these intertwined environmental crises are happening simultaneously and are actually feeding off each other. So you have crises not just like climate change, but others like biodiversity loss, the global pollution of our airs, our waters, our soils, the changes that are happening at our oceans, the scarcity of resources such as water, the alteration of biogeochemical cycles, especially nitrogen and phosphorus, and how we've been changing the land, deforestation, urbanization, among others, and how those crises are all interconnected and feeding off each other in very positive loops. And that what that has created is a reinforcement of not just power inequities, as we're seeing from this graph, but also health inequities. And what I'm trying to explain with this graph here is that with more environmental change, as you can see from here, paradoxically, populations that still hold and harness power, such as economic power, powers to access technology, powers to influence global policy circles, among other forms of power. And I'm talking here about the capacity to do and to fulfill one's agency. Those are paradoxically, despite the fact that we are degrading and contaminating and cutting down our forests and enacting climate change, those paradoxically are seeing an increase in their health gain. And we see this and we hear about this increases in life expectancy, increases in or decreases in maternal mortality rate, increases in nutritional health all around the world is happening in the populations that have access to those resources. But let us not forget that this is planetary health at its core, the conversation about equity and social justice as well. And when we look at the trends around populations with less power, that's the populations that have less voice, populations that have less economic resources, populations that have less social capital, populations and groups that have less capacity to influence global policy, those have already started to see the worst effects of environmental change. And it's widening our health inequalities, but also widening at the same time power inequity. So let us remember that one of the reasons that we do planetary health education is to leave no one behind. It's the reason why we focus so much in the concepts and of equity and social justice intertwined with these simultaneous global environmental challenges that we're facing. And the reason, and when we think of planetary health education, and the reasons that we embark on the mission to educate and train future professionals and future trainees that will go out into the world to try to face some of these challenges, I can kind of more or less split in three ways on what we expect these future practitioners to do, and some of these things you can expect also to gain from the course, the planetary health course that is being released today. Number one, as you can see here, is trying to understand the complexity, trying to understand how these really interconnected challenges to things like climate change, pollution, but also migration, but also conflict, but also socio-economic inequalities, how these things are happening simultaneously, and how to make those complex challenges really understandable, and try to analyze them from a lens that will allow us then to find more comprehensive solutions. The other thing that we must not forget is that this is a conversation also about hope and motivation, and providing good leadership to enable other actors, communicators, scientists, population in general, decision makers, in order to enable them to move forward, in order to find what the number three part is, convergent action, which is the one over here, in which we're trying to set the common goals that we all have as humanity, and have all these stakeholders work together. So when I think about the future of what is a planetary health practitioner, when I think about what does a person that studies planetary health does, I think of these three tasks, not just the science part, not just the hard communications part, but also the values conversation, also the convening conversation that must happen in order to reach our common goals. And it's also a good moment to note that the conversation is already taking off. Some of you might be the first time you're hearing about planetary health. Some of you might be aware of planetary health, but the conversation has taken off. Now we're close to a decade since the planetary health movement started, and we're starting to see not just more literature, but more presence in the media. Now we're influencing the planetary health movement. It's also influencing the COVID response. It's also influencing trade organizations. It's influencing health organizations throughout the world, including organizations like the WHO, and including governments that are also starting to embrace the planetary health conversation. So it's a good moment to be learning as this is picking up speed. But let's not forget that the goal of education should be to be able to live and thrive in a better society where we can balance our ecological systems with our human systems. And this is the core essence of this framework by Dr. Kate Raworth, which is called the donut. You might read about it in her book, The Donut Economics, in which what she says at the end is, okay, this is where we should be aiming. This green space here is where we should be aiming, in which we provide the necessary foundation of all these services: water, health, food, education, quality work, peace, political voice, equity, gender equity, among other things, right? And we're able, with the resources that we have from our natural environment, able to provide that for everyone, universally. And everyone means everyone, no one left behind. But we do that in consideration that there are ecological ceilings in place. There are boundaries that we must not cross in regarding our ecological degradation. So when we think of education, let us not forget that, yes, it is important to measure outcomes. It is important to measure, have these students learned? Have these students changed perspectives? What are the attitudes? What are the skills? What are the other things that these students are gaining from the education process? But let us not forget that the goal should be not forgotten, and that is achieving a better, healthy future for everyone. And that means taking care of our environment as well. And this is why the Planetary Health Alliance, we produced this education framework. And you might, if you're curious of reading more, you can read about it in our publication in The Lancet, in the Planetary Health Education Framework. And you just Google that and it'll come up in our website and in The Lancet. But in essence, what we're trying to do is steer the conversation in education around these five domains and have it be influenced by these local global processes. So when I think of the five domains, we have the core domain, which is reevaluating our relationship with nature. That is, for the most, a lot of the crises that we are in are at disconnection, a severe disconnection with nature. We have become so disconnected that we don't even think twice about the extraction and all the things that we are doing to kind of our planet now and in the future. And we must really reevaluate that relationship. And that means not just our relationship kind of as individuals, but also relationships as society. And then you have these outer domains that relate to, one, how we understand our challenges in living in the Anthropocene, how those relate to health outcomes, but also the lenses that we use to analyze these challenges. And I've spoken of the lenses of equity, and I've spoken of the lenses of systems thinking and complexity. And then there's another fifth domain that relates to starting to build the movement and starting to build the necessary a momentum to build critical masses to start seeing systems change. Without systems change, we're only putting band-aids over the problem, and we won't be able to reach long-term solutions. So with that, I hope that that this was an intervention that gets you thinking about why planetary health education is so important right now. And I'll just pass it back to the moderator. I hope to hear from you soon, and hopefully you'll be taking the course as well soon.
Okay, thank you very much, Carlos. Now, to talk about the importance of education for primary healthcare professionals, I'd like to invite Professor Ozen Gökdemir, correct?
Yes.
She's family and community physician and assistant professor of Faculty of Medicine
Yes.
at the University of Izmir in Turkey. In
Yes.
addition
Yes.
to being a doctor in physiology from the University of Dakar, Dr. Ozen is also chair of the environment group of the World Organization of Family and Community Physicians, WONCA. She's a member of WONCA Rural Council, WONCA Working Party on Rural Practice, and the ERIPA Executive Committee. Dr.
Yes.
Ozen, with you now.
Thank you very much. Well, I just begin with this Wonka Working Party Environment website because every information is there too. And I'm so happy to just share with you the real launching of the planetary health courses. Why? Because as you may see in the course, when you just get into application of it, everybody just needs good health and good well-being, but it can't be just be a sustainable thing, a goal without the planetary health. Well, just let's go a little bit forward or a little bit backwards. Asclepion is the master of the medicine and it is near to the Izmir where I live. And he is a famous physician there, and he just figured out the first psychiatric hospital in the 2nd century in Pergamon. And as this place also seen in here like that, they told that where the date is forbidden. And it is in the, as I said, Bergama in Turkey, near Izmir. As we may see, it is something very important with UNESCO too, because Asclepion is also means Galen. When we come to COVID-19, yes, it will be a goal to just say that couldn't come, but come to everywhere and didn't choose anything. But misinformation was very, very important, and it's just happened the vaccine hesitancy and the others or the treatment, even if we are talking about COVID-19. The truth is, pandemics hasn't finished yet, and it is just going on. And in Turkey, we are again in the rising position nowadays. Maybe we could remember Nietzsche. Nietzsche says that what doesn't kill you just makes you better, stronger, but it is not in the virus world. It just mutates and tries again. So how can we think about health for all? Why are we just struggling with this virus? What was the problem about it? The truth is we need collaboration, like forests do. And we look at the climate change and extreme heat events. That was the yesterday's webinar. We may say that there is a real bad things will happen and happening to us. As Carlos has said, most of the time it is just being for the low-income countries. We may say underdeveloped countries, maybe. How can we just get over it? How can we just make a resilience about our health and our health sector? For this reason, we may need the evidence and knowledge. How can you get this knowledge when there are lots of things about heat and vulnerability? Who will just make it? Well, the truth is we will make it. Who are we? You may say Andre from Irish colleagues, and you may say Shankar from here, Enrique, our last president, and Alice, and also Mayara. You may see all the people just working for it, and we are just keen on it. This is one the Professor Dr. Enrique de Boros has just printed on Hilo. That's also another way that we can just reach to each other. You may say that for the family's physician's perspective, doctrine, we may say that person-centered healthcare is so important. Okay, but planetary health could be just one of these duties and could be just with them, as you may see in the screen infodemic. How can you just make an engagement about it? Ellen has just told us in a national congress that, for example, air pollution or asthma. How can you just make it into green practice? You may say your patient that maybe it will be much more appropriate to walk or to just go outside for sports in not an air polluted day or night. If you are just known, how could you just manage it? And for the evidence-based data, we also made some of the papers that has been printed out. So it couldn't be just made with only one physician. The other sectors has to be just together, as I said, because the collaboration is needed. So we can say that what about the cases? For example, because in planetary health and for the family medicine, family physician, we will see people only by one by. So, for example, inhalers is one of them. And these are the posters that has been just printed out in the last Wonka. And we will need the clinical algorithm, how to diagnose, how to structure methods, what about the toolkits. So, to take immediate action and protect persons, we will need this evidence-based information and data. It is another problem in my country too, in Turkey too. Yesterday, people were clubbing because COVID-19 was a really bad enemy for them, and healthcare workers were the ones who are serving and saving the people. But today they are just making lots of violence about it. For example, our lecturer, he has been ENT professor, and he just died because of COVID-19. And at that time, there was no vaccination. He was just trying to save his patients. But now today in Konya, in the middle of Turkey, another cardiologist has been murdered because of the son of a patient. So when we just go through it, not only COVID-19 or planetary health, just behavior to the healthcare workers will be one of the important place for us. The thing is, for planetary health, we all think that we have got time. The truth is we haven't. That's also another picture from Turkey, Datça. It is burning. And yesterday it has been stopped being burned. Well, I just want to finish my words with Yaşar Kemal. It is in Turkish, but it says that the bad things are just being together. And that's why they are so strong. If we also come together, the good and the good initiatives come together, we will just get this power too. So we should organize. Who will organize? 1 minute for planetary health, for example, a tool to be organized. And so we can be the ones who can do this with evidence-based data, as I said before. Thank you very much.
Thank you so much, Ozen. Finally, I would like to invite Dr. Mayera Floss to talk about the course results and new features. She's a family physician in Brazil, PhD student at University of São Paulo in Brazil too, executive member of WONCA Working Party on Rural Practice, and member of WONCA Working Party on the Environment, Planetary Health for Primary Care course coordinator. Mayara, with you.
And a lovely volunteer and someone that is always asking things to telesaúde and always have your help. So thank you so much for those that were watching, and also Ozen, Carlos, and all the telesaúde team that's on the background that's not appearing here. I'm always really excited with all your work and how passionate you are with everything you do. So if I would say the name of everybody, it would be a really long list, and all the time I will be using it for saying the names of everybody that is involved at these courses. So I'm really, really happy to be here. It's been a huge effort for the last 3 to 4 years to make accessible planetary health education for anyone. Of course, there is some barriers of having internet or not having access, having a computer, but we started this very strange idea to make it accessible for all. And now we have already 3 courses. In one, the Brazilian one, which was the first one, and then we have the translation into English with the help of Planetary Health Alliance, and then we have the one that we created with the WONCA. And it's so interesting to see how we evolve it along this time, and how much we learn it. And this is not done alone. We have many partners, and everybody's helping and even pushing us. You should have it in Spanish. We should translate it into other languages. We should have it more accessible. And it's always a huge task and trying to listen to everybody and making the course more accessible and accessible to everybody. But I think we have done a good work in bringing people together and developing these courses and making them accessible for anyone that want to do it. So I think we have done with the courses is a lot of transdisciplinarity. I have been working with people from many different areas, and since like we have a huge work with the design team, and then we have like even to content developing, we are not just focusing on health professionals. We have people from different areas, and this makes us stronger. We are trying to make the knowledge accessible. We keep it free for anyone based on the right of education, and it's evidence-based, and it's a great design, and it's from Latin America. And I think this is and it's hosted in a Latin American, in a Brazilian platform. And I think this is innovative in many ways. We made it interactivity, but we also worked with the concept to make it not heavy for like low bandwidth internet for those that have difficult, and it's open. The story of being open at the beginning, I just wanted to do for health professionals, but then a young girl from the Fridays for Future, she was at high school, and she said, I want to do the course, why I cannot? And I say, I don't have a good answer for you, you should do the course. So I'm being coordinating all these efforts with the telesaúde team, telehealth team, and it's been a beautiful developing and evolving of everything. The first version, the Planetary Health course, we designed it to have this rhizomatic idea, and that the roots go differently, and we have the resources and pre-tests and post-tests, and then we worked in this other way to see it, so the top view. And I think people can, a lot of feedbacks that we received is that people perceive that there was like small learning things time by time, and then that's accessible, and we have the glossary so people can learn more about the dams and the definitions. And we have talked a lot about the color palette and how these covers change module by module, and this cause effect of the symbol. So every little thing of these courses have been thinking, and then with the relaunch, we have reviewed all the feedbacks, thousands and thousands of feedbacks, and people writing what they say to us to make it better and review this or that. And I think you should add this or that. It was a crazy work. It was like a lot of work. But I'm really happy that we managed to be relaunching it today. And with many improvements, we still have our badges, and that we are like, we added in a different way at this time, so people will have it more accessible to read the stories and the other things that we have been planned with these badges. So if you conclude the module, you receive one badge that will make your thinking, and then will bring another layer of knowledge that's not that that's related like to indigenous communities, or it's related to other ways to communicate with arts. So we still have at these courses the forum, and we worked a lot to make it more interactive and more accessible. So every single feedback we were trying to improve for you. And then we have our Planetary Health for Primary Care, which we designed it also, but in a rhizomatic way, but a little bit different. So we are now launching a new module on planetary health and migration. So I'm really excited about that. So those that will do the planetary health for primary care, you have a new module. And just for you to have an idea of the appearance of the courses, this is like how beautifully designed they are being and how colorful they are, but they also have like the dense content and all the evidences. And we have also for the planetary and primary care the badges for people. So if you complete the modules, you receive it. And we have more than 7,000 people that enrolled into the courses, into the 3 courses until now on the early versions. And we have 1,393 that concluded, that signed the consent form, and almost 1,500 that concluded. And I think it means a lot if you stop to think that 1,500 people have completed the courses, one of the courses on planetary health. That's a lot of people. And those people came from all around the world. So we have more than 69 countries, people from these countries that were enrolled. We sure have a lot of work to do for making it accessible to other places, but I still think we have done a great job. And now some of the courses are being translated into French, and we always plan to translate as well into Spanish, but one step by step. And for just you to have a little bit of an idea, we not bring like many data, but we have many of our students we're doing the graduation. So I think this is interesting because we can understand that people are using this as a complementary thing to their graduation. They came from different areas. We have many that are primary care workers, but we have also people that works as in education, like high school teachers. We have like people that were working in other areas, engineer, and also this brings us in a different idea of how we are like going to different places with these courses. We have published our first article about it. I do really invite you all to read it. And we have other articles that are on the way to be published. I hope they will be published soon. And the course is with free certification. There is no payment at all, and it's created based on the right to access education in planetary health. If you complete the activities, that's the only thing that we ask. With adequate grades, you will be certified. So this is really a bit of what Carlos were talking about, making planetary health education accessible. And that's why I'm really happy to be here relaunching the courses, and that we are able to possibly provide a great courses for many other thousands of people around the world. I do really invite you to enroll and to participate, and I do really hope you have a good course. And I'm so happy to be with you today. I'm not sure if anyone has a question or something, but I do really want to thank you, everybody that's involved, and you are awesome, and I'm really happy to be here today, relaunching the courses. Thank you. Over to you, Marcelo.
Thank you very much, Mayara. We are preparing to the end. Anna, we have some questions from the audience. No, okay, no questions from the audience. Um, well, and you, would anyone like to do a final speech? Carlos, Ozen.
Just to congratulate Mayara and the team for an amazing work. It's really been great to work with all of you and see this take off to a whole nother dimension that I never thought. So congratulations to everyone on the call, especially to Mayara for leading this.
Thank you very much.
Thank you all. It's been a pleasure to work with you. Like, you're being supportive, and thank you for being here. I know that is like midnight for Ozen in Turkey. So thank you so much for being here today and for being so accessible and making it accessible. And Telesaúde always have my heart because they are being very supportive to all the ideas and all the craziness with all the courses and different things that we want to do. So I think we are changing a little bit the things. I do really hope, and when we see the action plans that I haven't mentioned on the presentation, but we will analyze it better. We see how many people wrote about the course that it changed their inside and changed their behavior. So if we can change with MOOC, a massive online open course, people inside, I think we can change the world and how we see the world, and maybe connect humanity with nature again. That's what I want to do with all these efforts. So thank you so much.
Okay, Mayara, thank you for your leadership in this course, and we wish a great and productive course for everyone. Bye bye. Encerrou?